Hi, podcast fans. Welcome to season 6 of Lighting Your Way. This season, like our first one, highlights the stories of our nurses' work with our patients. At the end of each story, you'll hear at least one takeaway that we hope will empower you to be your own advocate. In this first episode of season 6, I talk with my guardian nurses colleague, Stephanie McCool, who shares a story about a young man who arrived in the ER with very common symptoms, but in the end, not so common a diagnosis. Welcome back to the Lighting Your Way podcast, Steph. It's good to have you again. It's good to be talking about this story.
Thank you, Betty.
Yeah. We've talked a little bit in previous seasons about, how do we encourage our patients to be more empowered and, to take ownership as much as they can of their healthcare experience. And I think that in season 6, we are coming back to our team and asking each one of you to tell a story and to give us your, in a sense, takeaway for the story, so that our listeners can learn and become more empowered and feel like there is a light at the end of the tunnel when they're dealing with the healthcare system. So I know you had a very good story the last couple of weeks. Why don't you tee it up for us?
Sure. So I met a young gentleman in his mid-20s a couple of weeks ago. I got a call about him, a direct call, and I went to the hospital to check in on him. When I got there, he was in a hospital room with his mom, dad, sister, and his fiancée. He was very sick. You could tell he just wasn't feeling well. He was throwing up a lot. He was very pale, very weak, in a lot of pain. So I asked him what had happened. Mm-hmm. And the fiancé said that about 5 days prior, he was at work and he started to experience some tingling and numbness on the left side of his face. Oh. When he got home, this kind of progressed and he became dizzy, but just a little bit dizzy, not too bad. The next couple of days, the dizziness got progressively worse and worse. And by the weekend, he had started with nausea, vomiting, and hiccups that just would not stop. He could not stop throwing up, regardless of what they tried. So he finally presented to the ER. And by the time he got there, on top of all of these symptoms, he was extremely weak. He couldn't even walk straight because his balance was so off. So they took him back. They did an exam. They did some labs and a CAT scan. Everything was okay from that. So the ER doctor quickly said, you're young, you're healthy. This is probably just vertigo. And they were ready to discharge him home. But
okay.
Yes.
Next.
Yes. No real treatment in the emergency room other than it'll resolve itself. Take some over the counter, meclizine for it, and you'll be okay in a couple of days.
Well, let me ask you. So the CAT scan was clear. The labs came back as, I guess, within normal limits. So there was nothing really presenting itself from those diagnostic tests.
No, those two tests were completely normal.
Okay. Did they do a neuro evaluation?
They did not at this point. Nope, no neuro eval, just quick ER doc. Okay. This is probably vertigo, nothing serious, will resolve on its own. And told him basically go follow up with your primary care doctor in a couple of days. And if it gets worse, come on back to the emergency room.
Oh. Okay. Wow. Not what they wanted to hear, I'm sure.
No. So in the emergency room, the fiancé was bedside, thank goodness, because she is a true advocate. She had been there for him. She had been there with him, experiencing all these symptoms. So she had said to the ER doctor, well, this all started with numbness and tingling on his face. Would vertigo bring that on? Is that how vertigo starts? And the ER doctor admitted, no, vertigo does not present with numbness and tingling. So she spoke up and she said, well, I think we need to do an MRI or more testing to figure out what's going on.
Wow, good for her.
I know. So
Ooh.
she's amazing. And she's young too, mid-20s. So
Okay.
it was amazing to see her advocate like that for him. So they did an MRI, and lo and
Oh, so
behold,
wait. So
Mhm.
based on her suggestion or based on her conversation with the ER doc, they allowed the MRI?
Yes. Yep, they did the
Wow.
MRI. I'm not she was very convincing, or maybe her bringing that up to the ER doctor made him remember, yes, we forgot. We forgot that this is how he presented.
Right.
Instead
Right.
of, the ER doc's just looking, oh, dizziness, nausea, vomiting, vertigo.
Right.
But they agreed to do the MRI.
Wow. And what did the MRI show?
The MRI showed 2 lesions in his brain. There was
Whoa.
a white plaque lesion on his brainstem, which was a pretty good size, and then a very small one on his the front of his brain, his frontal lobe.
Wow.
So
Wow, this must have been surprising to the emergency room doctor.
extremely surprising. Everything took a very quick turn. He was immediately admitted.
Wow.
He underwent MRIs of his spine, his neck. He had an MRI with dye to his brain. They actually set him up and they did a lumbar puncture to look at his spinal fluid to see if there was any infections or anything that would explain these lesions on his brain. And they
What were
actually,
they,
Mhm.
Steph, what were they thinking about at this point? Were they communicate? I'm sure the family was a little bit concerned now that they
Yes, they
found
were.
this. So
So
did the doctor communicate what they were looking for or ruling out?
Not at first. At first, they really weren't communicating, and then that's when I went up to the hospital and I spoke with them, and I kind of explained the test because unfortunately, the medical team was not communicating what the tests were for and what the results were. So
Oh,
after looking, I was able to get them set up with a portal so they could see all of his test results live in person.
oh,
And
that's
they gave
great.
me permission to sit there with them, and we went through everything. And from all the tests, it looked like they were ruling out any kind of infection to the brain, like a meningitis.
Okay.
They also were looking for multiple sclerosis because of the place of the lesions. They were ruling out cancer. So they were
Mm,
doing scans of his belly and everything too to make sure that there weren't tumors in other parts of his belly. They were the
wow.
3 big ones that they were
Well,
kind
I
of.
mean, from we're going to discharge you to to like every test in the book, right? To get
Yes.
a
Yep.
wow. Oh, they must have
Just
been
just
scared.
completely based on her pushing. That was the
Right.
amazing part. Um, so he was in the hospital, I think, for 3 days. Every test was done, every lab was done. It was the perfect workup. Neurology was involved, GI was involved, cardiology. They got every specialty involved to make sure that there was no stone unturned.
Right.
And at the end of the day, there was very minor concerns for multiple sclerosis.
Okay.
They also were considering that he had some sort of infection, that may not have been showing up, but an old infection that could have brought all of these symptoms on. And
Mhm.
they were suspicious that maybe the lesions were old from that.
Hmm. So prior to the Tuesday when he began experiencing, the initial symptoms, had like I had a case many years ago where, the the patient had actually it was like a month prior when something had actually happened and she had forgotten about it
Hmm.
because it resolved, but it was this incident where uh, it was a spore that got into her heart. I mean, it was a long story, but
Jeez.
but she had to think back, and it was really just through being reminded, kind of working through her day to day, that she was able to then, oh right, I that happened. Was there anything that the fiance or the patient remembered about his history that would have clued them
Yes.
in? Anything?
Oddly enough, back in June, he's very active and he was playing soccer. And his mom and fiance remembered that at one of the games, he took a soccer ball right to his head.
Oh,
And he felt a little bit dizzy after. No like signs of a real concussion or anything like that going on. But they kind of just forgot about it. He got hit in the head and that was it. They
right,
moved on.
right.
That's what that they did remember that had happened back in June.
And did the physicians think that that was important to the case, to the whole workup?
Initially, no. In the hospital, they did not.
Okay.
But at our follow-up appointments, that really came into play.
Huh. Why? What was the suspicion?
So we were able to see, we went to 2 different health systems to see their neuroimmunologists, to have them look at the scans and see about this multiple sclerosis possible diagnosis. And they reviewed everything. Everything was negative for multiple sclerosis, except
Wow.
for these small lesions that were, worrisome, slightly worrisome. So she went through the history, really focused on this injury back in June.
Hmm.
And what she said, which I've never heard of, I learned something new this day, that a concussion, he probably suffered a concussion back in June. Brain takes a long time to heal and get back to normal. So he probably developed a virus, which brought on, the symptoms of nausea, vomiting, all of that, not feeling good. But as that virus was brewing in his body, all of the concussion symptoms came rushing back,
Wow.
which I've
Wait.
never heard of that before.
No, that's a wow. That was the neuroimmunologist coming up with that?
Yes. Yeah.
Wow.
She was wonderful.
Wow. So
Yep.
a neuroimmunologist. Now, so explain what that is. So a neurologist is obviously working with the brain and its function. An immunologist is working on, the immune system and things that can go wrong.
Mhm.
How do you bring the two of those together in a neuroimmunologist?
So there are certain conditions that affect the brain that are brought on by the immune system, kind of attacking itself. And one of those diseases is multiple sclerosis. So for some reason, the immune system actually attacks the myelin cells in the brain. And that is what causes multiple sclerosis. So because that was suspected, they wanted him to see a specialist who really, really is familiar with what the lesions look like when it comes to multiple sclerosis.
That's great. Right.
Mhm.
And did you go with them to that appointment?
I was on the phone. They have a very large supportive family. So they were only going to allow 2 in. So
Couldn't
they
get a
snuck in
ticket for the
3.
appointment, huh?
And then
Standing room only there.
Exactly. So I stayed on the phone with them for this visit and all of their visits. So this way I could be looped in and I could ask questions and make sure that, they were getting an appropriate level of care.
That's great. That's great. Yeah, because I'm sure. Listen, I'm sure if they're coming out of the hospital with all the stuff that's coming at them, all the information, all the appointments, all the tests, to have you there to decipher much of it was extremely helpful. I bet.
Yes, because
Yeah.
in the hospital, the workup was so intense. When he got admitted, there were just test results coming every 5 minutes.
Right.
So, I was happy to be able to be there to go over each result in live time to kind of give them a little bit of an explanation, like, oh, not looking like an infection, or this is what it could be. This we can rule out. So I know that they were very thankful for that.
Yeah, you're part of our role is like an interpreter, right? So when
Yes.
test results are coming in, we can interpret, and to be there in real time, as you said, is hugely helpful, especially
Mhm.
when they're, as I said before, they're scared, right? This stuff is coming at them pretty quickly, and he's young and he's healthy, and all of a sudden he's nauseous, can't walk straight, and it's scary.
Yes. Very
Yeah.
scary.
So what was the final outcome? So the neuroimmunologist renders her opinion, and what was the final outcome?
So that is pretty much what we're leaning towards. They're going to do a repeat MRI in November. But the neuroimmunologist and the neurologist really don't believe that he has multiple sclerosis. They kept saying there's always the possibility, but with everything else being negative and the way his symptoms took a long time to resolve, they really feel like it's not, which is great news.
And we're recording this in September. So is he feeling good? Is he back to work? Is he
He
normal? Like his
is.
symptoms?
Yep. I guess it took about 3 weeks for the symptoms to really resolve. And the neuroimmunologist said it would take about 3 weeks usually for your body to completely rid yourself of a virus. So she was spot on with the timing. So he is back to work. He's feeling good, an occasional headache, but he's back to his old self.
And pending the results of the additional testing in November, he'll then not have to follow up with anybody.
If it's stable, they'll probably just see him. I believe neuroimmunologists will do a follow-up in about 6 to 12 months just to make sure there's no changes after that. But if it's gotten smaller, if these kind of weird lesions are resolving, then they'll probably just tell him not necessary, no more follow-up.
Wow. So, what's I guess heartwarming to me about this story is that once they did do the workup, thanks to the fiancé asking, it sounds like they did a good job of making sure that all all issues were addressed, or they looked under every cupboard and inside every cupboard and made sure that he was at least getting the testing that he needed to make a determination. So that makes me feel good that the healthcare system, without too much pushing by you, so that makes me feel good. Although, with any kind of crisis and urgency, it's nice to have you there explaining things. So that's, the value of having you as your mobile care coordinator is a lot, it's a lot more impactful than hearing about it the next day and trying to explain it.
Exactly. Yeah. The being there lifetime really, I think, aided in them dealing with the whole hospitalization and the crisis that they were in.
Yeah. So, Steph, we talk about this all the time, and I know that I've asked our other colleagues and our other guests, when you hear stories like this, or you go through a situation like this, we're nurses, we do it kind of just with our eyes closed. What to you was the takeaway for this, for our listeners who aren't nurses or who don't have a nurse in the family? What would you like to recommend to non-clinical people when they're going through something?
So always trust your gut. If your family member or yourself are not feeling well, you know your body and your family member's body better than any healthcare professional that, they're just meeting for the first time. So be sure when you go in, give a good history, list every symptom that they've been having, anything that seems off about them, because that will really help guide the doctors in coming up with a diagnosis. I think sometimes doctors will look at someone and just check the boxes in a sense in the emergency room. Like, this boy, he was young, he was healthy, no medical problems. So, okay, nausea, vomiting, dizziness, vertigo, and just checked it and really didn't think about that full history and the symptoms that started everything in the first place. So trust your gut and push.
Yeah, were it not for his fiance kind of, and I guess one of the things I remember, I read this book many years ago, How Doctors Think, and they talked about just the linear differential diagnosis. They go down, to your point, checking boxes, thinking about, okay, nausea, vomiting, dizziness. Okay, if it's this, then it's that. Boom. And what you need to do as a patient or as someone advocating for a patient is to get them to think outside of that linear up and down line.
Yes.
You have to, one of the suggestions the book made was to say, okay, what's the worst that this could be? To kind of encourage them to think outside of that line.
Mhm.
And I know it's not necessarily the greatest question you want to ask a doctor in a crisis, but what's the worst this could be? Because it makes them stop and think about all the potentials that it could be and go down to the quote worst,
Yes.
so that they can hopefully have a discussion with you, and then you can think about the alternatives. Like the fiancé did is, you know, does vertigo present with nausea and vomiting? Or I'm sorry, with
the
left-sided, I'm
tingling.
sorry, with the left-sided weakness, yeah, tingling on the facial. And no, it doesn't. Okay. So she made him think outside of that linear approach. And I
Yes.
think that really helped him for sure. What if, I guess I don't, I mean, we could always deal on what ifs, but if she hadn't and they get discharged, then he comes back, then it's yet another frustrating time for them. They come back in, maybe he's, God forbid, a little worse, right? So then we're behind the 8 ball. So,
Yes.
All around, it was better for her to challenge the physician at the time prior to discharge. So good for her.
Yeah, he definitely would have presented again to the ER probably several times until he was admitted, because until he got the fluid and, anti-nausea meds and everything in his system, IV, those symptoms really didn't start to resolve. So he would have went downhill pretty quickly, especially with the dehydration.
Wow, what an experience. I mean, I'm so happy that he's well, right?
Mhm.
And on the mend, as we say, and his brain's recovering. Those viruses are nasty little things.
They are.
They can really throw a whole body into some weird stuff.
Bring up things that, you don't even think about it. It's crazy.
Yeah, that case I was telling you about, that young woman, she had been rafting in the Brandywine, and she essentially, a spore got into her body and attacked her heart. So,
Jeez.
young woman, but she's doing well now, and she's actually now a physician. She's going into cardiology. Wow. Yeah, great story. But Steph, thank you for telling us about this one. I am so happy that he's well and that you're there to support them, because your help is just as valuable as having a fiance who's got the ability to stand toe to toe with an ER doc and question him. So thank you for being on the podcast, and thanks for telling the story.
Oh, thank you, Betty.
All right, take care. We'll talk to you next time.
Okay, thank you.
All right, bye-bye.
Bye.
If you have any questions that you would like us to address in a future episode, please email us at podcast@guardiannurses.com. That email again is podcast@guardiannurses.com. We would love to hear from you. Thank you for joining us this week. You can find the Lighting Your Way podcast on Apple Podcasts, Google, YouTube, Spotify, and Stitcher. If you liked what you heard, tell a friend and leave us a review. You can learn all about Guardian Nurses Healthcare Advocates on our website, guardiannurses.com. So until next time, find some joy in your life, pet all the good doggies and kitties, and remember to tell your people that you love them. Take care.